Welcome back, students. This biology session, we continue with this chapter, the reproductive health. Now, those who skipped the first part, the first session of the reproductive health, this is actually the quick recap. What are the things that we discussed in the first session of the reproductive health? We discussed the introduction of the reproductive health and reproductive and child health care. The objectives of reproductive and child health care we discussed, and population explosion, the reasons of a population explosion, effects, and what are the remedial steps that you can take to reduce the population explosion, that also we discussed. And then family planning, where the natural techniques and the chemical and the barrier techniques that we discussed. There we discussed about the physical, lactational amenorrhea, interruptus coitus that we discussed, and IUD, that is intrauterine devices that we discussed, and different calendar method. These are some of the areas that we covered. Okay. So continuing with that, we move to the next part. So we'll move on to the sterilization. Sterilization is actually the permanently, like, if the couples want to have the, complete solutions, like permanently, they don't want to have the child, right? They don't want to get, the women, she don't want to get conceived, then they can go with a technique called as sterilization. So, okay. Good afternoon. Okay. So thanks for joining. We continue with the session. Sterilization after this break. Okay, fine. Sterilization. We have two types, like, male as well as in female. This permanent solutions, like, permanently, like, we can stop getting fertilized, the women getting fertilized. In male, this is called as vasectomy. This technique, this we would have studied in the textbook itself. This we call it as a vasectomy, and the female we call it as a tubectomy. So in vasectomy, the male, what we're doing is actually, like, the fluid. So what is the main objective of the sterilization? The sterilization where we're going to block the gamete transfer. The gamete may be the male gamete, the sperm. The female gamete, we talk it as an egg, ovum, we talk it as, right? We're going to block the gamete transfer. Either we do with the male or we do with the female, actually. So in male, if you do this, we call it as a vasectomy. In female, this technique, we call it as a tubectomy. The procedure, when you go for the procedure, it's not a lengthy procedure. It's a very short, procedure in case of males, where you could see. Where you're going to, like, this is a 15 to 20 or 30 minutes maximum, this procedure it takes. Where you could see, like, you could see the testis from this, like, vasa, difference that you could see. And here, we're going to get, this is going to get cut, and it's going to get, like, tied, actually. This tube is going to tied. In this case, males, where the vasectomy, just within 15 to 30 minutes, this procedure will get completed in case of vasectomy. But in case of tubectomy, what happens, like, here the fallopian tube, you could see this is actually the ovary, for the ovary that you could see, and here this is the fimbriae, and this part is called the complete part, the tube-like structure you could see, right, on both the sides. This you could see is the fallopian tube. Here, the fallopian tube that we're gonna cut, the incision that we're gonna do it, and it's going to tie, because the fallopian tube, which is going to carry the eggs, actually. So once if we cut the fallopian tube, right, we make incision over here in this place, where you could see what happens. We're going to cut it over here. Then the fallopian tube, which carries the eggs from the ovary, are tied and cut. So there's no chance of the egg from, because the ovary is going to produce an egg. This egg is going to, like, anyway, is going to come here. Since we're going to cut this place, the passage, right? There should not be any having continuity here. Like, the sperms even cannot get inside. Even the ovum, which cannot come after this, actually. So what happens? We're going to cut the fallopian tube and going to tie it over here. This is also like small procedure that we could do it in case of tubectomy, where in case of females. So vasectomy and tubectomy, these two are techniques that is a sterilization permanently. So far we discussed the techniques where you could see, like, temporary solutions, where you could see the natural techniques or the chemicals, where you could see the IUDs, the Saheli. These are actually only the temporary for 6 months. If they don't want actually this type of device, they can remove the copper B, and they can stop taking the pills like Saheli. Once they want to carry the baby, the women, very well, she can continue. But once they do with the sterilization, this is a permanent stop, where permanently this is going to get stopped, like, going to arrested, where the main objective of sterilization is it block the gamete transfer. So they block it, so there's no chance of fertilization which takes place, because we're going to cut where in case of, like, the male reproductive organ, the vasectomy, where you could see the tubectomy. Can you tell me which tube that we're going to cut? I told you in female, it's a fallopian tube. Can you name this tube? What is actually this tube that we're going to cut in case of male? So in female, it is a fallopian tube. What is actually this tube? What is the name of the tube? What is actually this place? This structure we call it as? When we're going to make incision over here, we're going to cut it over here, right? So what is this? What this part we call it as in case of male. So this part that we're going to do it, right? What is the name of it? So vas deferens. So the vas deferens that we're going to cut it, right? So this is sterilization, where completely she may not get conceived because this is a complete solution or permanent solution. Coming to the next part, where we discuss about the medical termination of pregnancy. Coming to the medical termination, what is the other name for medical termination of pregnancy? Sometimes they'll ask you the question, what is the other name? The MTP, இன்னொரு பேர் இருக்குன்னு சொல்லுவாங்க. What is the other name for MTP? That is, expansion for MTP is medical termination of pregnancy. There are certain genuine reasons, not all the cases, like certain genuine reasons where they can do the medical termination, they can stop the pregnancy, right? So there was other name for medical termination of pregnancy. Yes, you're right. It is induced abortion. Induced abortion is the term that we give for medical termination of pregnancy. So what is actually MTP stands for? Medical termination of pregnancy, it refers as the induction of abortion. So that we call it as like an induced abortion. The induction of abortion may be legal and illegal. Sometimes they do it legally, sometimes illegally also they can do it, because in adolescent age, the young chick, the young girl, she become pregnant, like she'll be experiencing a lot of ethical problems, a lot of accusations, right? For that, illegally also sometimes the medical termination of pregnancy can be done under the guidance of the medical practitioner or the gynecologist. There are many countries in the globe where the abortion is not yet legalized. In many countries where it's not yet legalized, illegally they are doing actually this type of abortion. In India, the abortion was legalized by Medical Termination of Pregnancy Act, the act which was amendment which was passed in the year 1971. Sometimes they'll ask this question, the year where the medical termination of pregnancy which came to effectiveness where in 1971. It has been enforced in the April 1972, the amendment which is passed, and complete action which took place from the year 1972, but they introduced in the year this act, medical MTP Act, which was developed in the year 1971. So this year we should be very careful. The other name for medical termination of pregnancy is induced abortion. Okay, now we're going to discuss about the types of MTP. So can you tell me the duration, when till how many weeks we can the doctors prescribe MTP? How many weeks? For example, the woman, she got conceived. Can you tell me how many weeks after she get conceived? Till that point of time only, medical termination of MTP is allowed. Can you tell me like how many weeks the doctors prescribe the women can take up the medical termination of pregnancy? What is the maximum time? Only that point of time, on the time where the induced abortion பண்ணுவாங்க. அதுக்கப்புறம் once, because the fetus when start developing inside, once it fully developed, they will not encourage, because அதுக்கப்புறம் நீங்க induced abortion பண்ணீங்கன்னா it will be a catastrophe for either the குழந்தைக்கு மட்டும் இல்ல அம்மாக்கும் வந்து பெரிய பாதிப்பா இருக்கும். So அதனால what is the time duration is given by this performing the medical termination of pregnancy? Usually they do 20 weeks of time. So 20 weeks is the maximum time. After the 20 weeks of time, MTP, that is medical termination of pregnancy or abortion, will not be allowed actually. So 12. So sometimes they do it 12 weeks. Sometimes they can even extend to 20 weeks of time, but definitely not after the 20 weeks of time. They'll stop with the 12 weeks. As you said, the 12 weeks are correct, but they can very tough situations, they can extend to 20 weeks, but not after the 20 weeks. They'll stop with the 12 week itself. Okay, so now we're going to discuss about the MTP types. DNC. So you would have heard about DNC. Can you give an expansion for DNC? நீங்க நிறைய இடத்துல கேட்டிருப்பீங்க DNC பண்ணிருக்காங்க அப்படின்னு. What do you mean by the DNC? Can you give me the expansion for the DNC? The DNC is also like the procedure where you could see the induced abortion. The induced abortion first ஒரு டெக்னிக்ல பண்ணுவாங்க. This technique we call it as a DNC. Okay, fine. So DNC is a dilation and cartridge. DNC stands for dilation and cartridge. The expansion for DNC. This dilation and cartridge, where you could see the cervix is dilated. Why we call it as D and dilation means they're going to dilate. Cervix என்ன பண்ணுவாங்க அப்படின்னு கேட்டீங்கன்னா dilate பண்ணுவாங்க. So dilate பண்றது யூஸ் பண்ற instrument that we call it as, this is actually we call it as hysteroscope. This is called hysteroscope. By means of hysteroscope, what they're going to do is in a induced abortion, in medical termination of pregnancy, the hysteroscope வச்சு என்ன பண்ணுவாங்கன்னா they dilate cervix என்ன பண்ணுவாங்கன்னா they dilate the cervix and then what happened, they remove actually the implanted ovum will be removed actually. So 12 weeks la da irukum completely develop ஆயிருக்காது fetus. So 12 weeks or maximum 50 weeks like the ovum implant ஆன ovum என்ன பண்ணிடுவாங்கன்னா they will actually cartilage. So that is what we call the dilation and cartilage. So this we call it as DNC. They'll do like in 12 weeks of time or maximum 20 weeks of time by using the instrument called as hysteroscope. The principle is the dilate the cervix and they remove the implanted ovum. This technique is called as DNC. This is one of the technique that we go for the induced abortion. Okay, well, next technique enna appdin pathina idu nam edha pathi paakrom MTP. So second technique we call it as vacuum aspiration. What is actually the vacuum aspiration? Vacuum tube mari ulla poduvanga, suction pump mari actually vechi enna பண்ணுவாங்கன்னா they will remove it. In vacuum aspiration what they will do, this they will do only up to 12 weeks of time. Okay, in the procedure the vacuum aspiration they will not extend to 20 weeks of time. The vacuum aspiration, this technique they will do only the maximum of 12 weeks of time. As you said before, the 12 weeks and the 20 weeks vacuum aspiration la only the maximum of 12 weeks of time varakum da the technique பண்ணுவாங்க vacuum aspiration. So up to 12 weeks of pregnancy where they will do it and they implant, that is like implanted ovum is actually which is removed. But here you could see like here you could see the attachment of the vacuum unit. You could see the attachment of the vacuum unit and you could see the tube-like structure. You could see, right? This is curette, we call it as curette, and this canal which pass into the vagina. So this is a vaginal canal we could see, and you could see inside, right? This is the uterus part over here. This is the uterus and this is the amniotic sac and this one is the implanted ovum. This is not complete developed fetus னு சொல்றது, இது implanted ovum actually. இது என்ன பண்ணுவாங்கன்னா aspirate பண்ணி என்ன பண்ண vacuum வெச்சு என்ன பண்ணுவாங்கன்னா the pressure குறிப்பிட்ட pressure வெச்சு என்ன பண்ணுவாங்கன்னா they will suck it and the implanted ovum will be sucked out by means of this technique. This is called as vacuum aspiration. This they will do only with the 12 weeks of time வரைக்கும் மட்டும் தான் இது பண்ண முடியும். Okay, so fine. Next வந்து prostaglandin. Third technique ஒன்னு இருக்கு, medical termination. இந்த technique மூலமாவும் you can do an induced abortion வந்து induce பண்ண முடியும். What is that actually? Prostaglandin, what is the main function of prostaglandin? The prostaglandin வந்து administer பண்ணும்போது what reaction will take place? What is administration? What is actually action of prostaglandin? The prostaglandin in the injection inject பண்றோம் இந்த விமனுக்கு அப்படினும்போது 12 weeks of time குள்ள நம்ம inject பண்றோம் or 14 weeks குள்ள inject பண்றோம் அப்படினா என்ன ஆகும்னா this prostaglandin which increase the uterine contraction. So this will influence the எதை அதிகப்படுத்தும்னா யூட்ரினோட contraction வந்து increase பண்ணும். அப்ப this increase the uterine contraction, this contraction which leads to abortion. So automatically what the uterine வந்து contract ஆகும்போது எப்போ uterine contract ஆகும் at the actual time of like patrician time la வந்து delivery time la the uterus வந்து contract ஆகும். That is also because of like the hormone, the birth hormone. But when you administer this one, this is called as prostaglandin. The prostaglandin, this will influence the uterine contraction. This uterine contraction which leads to the abortion of the child. This also one of the technique where we can go for medical termination of pregnancy or induced abortion. Okay, more technique further. Next, we're going to discuss about the thing actually infertility. Nowadays actually the infertility is one of the big headache and the problem that you could see in the even young people, newly married couples. Those days actually though there was not so much of the problem with the infertility, but nowadays if you could see like a newly married couples, like they may be a female or a male, they may be like important and they just knocking the doors of like fertility centers. You would have seen a lot of fertility centers coming forward and they're trying to solve the problem actually, right? They estimated actually 60% of the people, the newly married couples, they are actually visiting the fertility center and they experiencing the infertility problems. Out of that, only 30% of the issues only is getting resolved. This is one of the statistics says actually. Now, infertility is one of the main cause that you could see in this case actually. You could see in this case, prostaglandin main, that's what I told you, like prostaglandin main function, it influences the contraction of the uterus action. So this influence under the influence of the pituitary gland. நீங்க endocrine system நீங்க படிச்சிருக்கும் போது prostaglandins பத்தி படிச்சிருப்பீங்க, right? Where you could see this influence the pituitary gland, and this influence the uterine contraction. Under the influence of the pituitary gland, the prostaglandin can function actually, so it leads to the abortion. Okay, well, fine. Now we move on to the infertility. Coming to the infertility, what are the prime causes of infertility? Infertility வரதுக்கு என்னென்ன காரணமா இருக்கும் அப்படினு பாத்தீங்கன்னா, there are many reasons that you know in the pie charts says actually. Here you could see the 21% where you could see the sperm problem, where the male might be having the problem in the sperm production. Sperm production le vandu sometimes they may be having a problem. So sperm production and ovulatory failure in females, where you could see the ovulatory failure. The ovulation may not take place, ovum may not get released out of, like, you know, you would have studied in the follicles may not, they may not be having sufficient follicles inside the ovary. நீங்க படிச்சிருப்பீங்க primary follicle, secondary follicle, Graafian follicles. These follicles would have not been produced properly, so ovum egg will proper produce ஆகாம இருக்கலாம். So ovulation proper nadakada reason, this comes like an 18% this consists of. And tubal damage, sometimes the fallopian tube illa vas deferens in the tube la, even though there's production takes place, sperm produce agudhu, egg produce agudhu, but எதுல ப்ராப்ளம் இருக்குன்னா fallopian tube ப்ராப்ளம் இருக்கு, இல்ல vas deferens ப்ராப்ளம் இருக்கு, transport of the male gametes வந்து ஏதோ ப்ராப்ளம் இருக்கு, அதனால கூட maybe infertility may occurs. And maybe like, you know, cervical mucus, I told you, like, you know, the cervical mucus secretion, improper secretions of the mucus, அதுவும் சில நேரத்துல sometimes என்ன ஆகும் கேட்டீங்கன்னா infertility cause பண்ணும். So coital problems, maybe erection of the penis, இந்த மாதிரி சில problems may be like, you know, what happens, like, you know, this may not take where the, you know, intercourse may not take place. This comes like 5%. Unexplained reason, there are many other cases, அது வந்து stress ஆ இருக்கலாம், உங்களோட லைஃப் ஸ்டைலா இருக்கலாம், maybe like food habits ஆ இருக்கலாம், maybe like, you know, there are other, like, you know, personal things that is like, you know, there are many other things unexplained. That's why I mentioned the red way 28% where you could see that, you know, there are other problems like, you know, okay, so yeah, this is also like, you know, the unexplained problems that you could see. These are some of the causes for infertility, right? So male infertility causes, male or infertility enna causes that if you could see, as for the male, this can be classified into pre-testicular. We're talking about the male specifically, testicular, and we have the post-testicular. There are three categories that we can classify: pre-testicular, testicular, and the post-testicular. Coming to the pre-testicular, we have the hypothalamic disease. Maybe like, you know, the male might be having any of this hypothalamic disease. We're having like, you know, gonadotropin deficiency. This gonadotropin deficiency, we call it as like, you know, Kallmann syndrome. This syndrome we call this only in male, you could see. Kallmann syndrome. So wearing tight-fitting clothes also a causes of infertility. Yeah, they have proved actually, like, you know, they're wearing the tight clothes, like, you know, sitting in a long place, they're sitting in front of a computer, having a stress and having intra-abdominal pressure. There are minimal chances also wearing tight clothes, you know. This also sometimes like, you know, smoking, you know, boozing, right? This type of, you know, habits, and, you know, this also may cause infertility. There are chances are very less actually. There are some chances out there. Okay, fine. So then isolated LH deficiency, luteinizing hormone deficiency. These we call it as infertile units, we call it as, right? Then these people are called as units. And isolated FSH, that is follicle stimulating hormone deficiency. Then congenital hypogonadotropic syndrome. These are all which comes under hypothalamic disease. If the particular male is having this hypothalamic disease, இதுல ஏதாவது ஒரு ப்ராப்ளம் இருக்கும்போது மேல் ஸ்டெரிலிட்டி வந்து கண்டிப்பா வர சான்சஸ் இருக்கு. pituitary disease, pituitary ஏதோ ப்ராப்ளம் இருக்கு, அப்போ pituitary insufficiency, hyperprolactinemia, exogenous hormones, growth hormone deficiency. So pituitary வந்து நார்மலா ஃபங்க்ஷன் ஆகல அப்படின்ற கண்டிஷன்ல கூட அங்க வந்து reproductive organல ப்ராப்ளம் சொல்ல முடியாது. Where the problem is with the pituitary itself, the gland itself, the master gland itself, அப்பயும் என்ன ஆகும்னா மேல் வந்து will become chance of getting infertile வரதுக்கு chances இருக்கு. Okay, fine. So then testicular is the chromosomal. These are all the syndromes that you could see, right? Klinefelter syndrome, XX male, XYY male. You would have studied like Turner's syndrome. These are all syndromes that you can say. Non-chromosomal, where you could see like, you know, varicocele, you know, these are the conditions where the chemoradiotherapy, for example, the patients who take experience in more of radiotherapy. For example, radiation இருக்கிறவங்க எக்ஸ்ரேல அதிகமா ஒர்க் பண்றவங்க ரேடியேஷன் அதிகம் படுற உடம்புல எல்லாம் என்ன இருக்கும்னா there are chance of like, the male can become infertile. So that is also the reason. So radiation, radiation pada, maybe you take like X-rays and gamma rays and the non-ionizing radiations, the radiations மூலியமா கூட infertile ஆகிறதுக்கு chances அதிகமா இருக்கு. So the place, the profession, people that work in the radiology, these places also they should be extra cautious. They should not get exposed all the time, mostly with the radiations. This is also because of chemotherapy, radiotherapy, or they take most of the steroids, drugs, tablets. In the chemotherapy also, there are certain chances where this leads to male infertility. This also can do it. Okay. Then post-testicular congenital blockage of the ductal. Block maybe the vasa deferens, the seminal ductal. What happens, like there will be blockage, and also you could see in cystic fibrosis. Anti-sperm antibodies, you could see like anti-autoimmunity Mary. Unga sperms the particular male's immune system, it would have started producing an antibody. Even that time, what happens, like it would have started acting against its own sperm, considering the sperm as an antigen. So anti-sperm antibodies and ejaculated drug obstruction. So there are reasons where the male can have a chance of like infertility. Okay, so even sometimes we take the practices, early age practices, masturbations. Like there are some of the cases where you can see where this may lead to the infertility, where the male partner may not have the good sexual relationship with the female after marriage. Coming to the next part, female. Coming to the female part, the female infertility, where you could see the signs and symptoms. Or female for infertility, symptoms. Sometimes what happens, it may not cause symptoms theriyadu. Sometimes irregular periods. The periods might be irregular. By that itself, like a continuous periods delay pogudhu. The female has to go and consult with the proper gynecologist. And ovulation problems. Ovulations are proper 14th day egg produce delay luteal phase or 21 day days So the ovulation problems. Signs of the hormonal imbalance. Maybe the hormones which is getting secreted by the pituitary, it may be the problem. Low follicle count. I told you inside the ovary, the follicles, maybe the primary follicles, the Graafian follicles. These follicles, like it may be having, like the count may be less. Then the blockage. There will be some blockage in the fallopian tube. This tubular blockage also may cause problems here. Then you could see the causes, where you could see obesity. We could see the obesity, low ovarian reserve, and you could see endometriosis, ectopic pregnancy. Can you tell me what is ectopic pregnancy? You know what is normal pregnancy? What is ectopic pregnancy? Can someone define ectopic pregnancy? In the type of pregnancy, what type of pregnancy is this? Ectopic pregnancy. Usually what happens, the fertilized egg will come to the uterus and it will come to the lining of the endometrium. There it will be implanted, and now what will happen? The zygote, the embryo development, formation, that everything will take place. Right? The fetus will start growing after the implantation. But what do you mean by ectopic pregnancy? These are a different type of pregnancy, but there's slight difference in the normal pregnancy. So here in the ectopic pregnancy where other than the uterus is தவிர்த்து வேற ஏதாவது ஒரு ஏரியால, maybe fallopian tube, mostly in the fallopian tube என்ன இருக்கும்னா அது அங்கே நின்னுடும் embryo. அது நகர்ந்து போகாது. So what happens, like here itself it will get stopped here. So here itself the embryo will get stopped. So this will not move further. Usually this is the place where in the uterus, the endometrium lining, this is where the implantation takes place. But what is happening in ectopic pregnancy? In ectopic pregnancy, its embryo is getting staying back in the fallopian tube itself. So this is called as actually ectopic pregnancy. And this also may be a reason problem actually. And also STD, if the female, she's having like any sexual transmitted diseases, like maybe asymptomatic, that time also like it may lead to infertility. It is not properly diagnosed, panama treatment kudukam irundirukku and the situation la, therefore the female may have the problems with this. And test la pathina self assessment test pannalam. Then ovulation test kits are there. They'll perform the test and they'll find out whether female is infertile or not. Blood test panni pakanum. Then we have the ultrasound. Then we have a smear called as pap smear. This pap smear usually they'll do for pregnancy test. We call it as pregnitus. And the HCG, what is the name of the hormone? We call it as, we use just to take the confirmation for pregnancy. Urine enna hormone irukum? HCG hormone. What is the expansion for HCG hormone? Because the presence of HCG, this confirms the woman is pregnant. So usually blood anga enna பண்ணுவாங்க, pregnant test urine sample collect பண்ணுவாங்க. urine sample la HCG irukkum. What is expansion for? HCG. This HCG, presence of HCG, which confirms the woman is pregnant. Usually like pap smear kuda vechi பண்ணுவாங்க இல்லனா pregnancy test vechi பண்ணுவாங்க சரிங்களா. So these are the tests actually they do it. Okay, this HCG stands for human chorionic gonadotropin. Exactly, human chorionic gonadotropin. This is one of the hormone which confirms the woman is pregnant. And treatments lifestyle proper இருக்கணும். Lifestyle changes, vitamins and herbal supplements ஒழுங்கா females எடுக்கணும். Then if it is not working out, then she can go for medical and she can go for the surgery. So these are about the female things actually. Now we move to the last two parts of this chapter, that is assisted reproductive technologies. We call it as ART. Assisted reproductive technologies, I told you already, the statistics says 60% of the couples they're actually visiting the infertility center, they couldn't have the women or maybe problem with maybe the husband, or problem might be with the wife as well. So they're visiting the 60% of couples with the problems of infertility. Out of the 60%, wow, there are many techniques we're going to discuss one by one. Only the 30% of the problems is getting resolved by means of the technologies we call it as assisted reproductive techniques, or we call it as assisted reproductive technology. Now we're going to discuss one by one, right? So after the treatment, there are successful rate is actually only out of 60%, 30% they can have a baby and they can have a happy life. But remaining 30% again, maybe there are many issues maybe the procedure, the technology, maybe these techniques may not work out. Okay, fine. So we're done with this part, right? So that's what actually baby child is actually is a gift from the God actually. So that is what actually many people they're suffering without the child actually, infertility, maybe the problem with maybe anything, maybe couple, maybe with the husband or maybe with the wife, right? Now we're going to discuss how we can overcome these problems, what are the different techniques by which we can give the happiness to these couples, that we're going to discuss one by one. Okay, now first we'll discuss about artificial insemination. So what is artificial insemination? Artificial insemination is the first thing. What do we do in artificial insemination? As the word tells you, insemination, we are injecting what? Injecting the semen which consists of what? Semen consists of sperms actually, but we are doing it in an artificial way, where semen is artificially introduced with the type of syringe either into the vagina or into the uterus. So what we're going to do is we're going to inject, right? It's not like the natural way, but this semen is going to get injected by means of artificially. So artificial technique by means of which, this is actually, you could see the washed sperm. The sperm, this actually washed sperm by means of this type of syringe that you could see. Here the sperm is going to get injected. So this injected sperm which will be migrating, it will be injected to the vagina, or it may be injected directly into the uterus part. So this type is called as artificial insemination, or simply we call it as AI. AI stands for artificial insemination, where the sperms which can be directly injected artificially to the female reproductive tract actually. Okay, so this is the first technique. Next we move on to the GIFT and the ZIFT, where GIFT, what is the expansion for GIFT? GIFT is, you could see, yeah, GIFT is gamete intra-fallopian transfer, that is GIFT. ZIFT is a zygote intra-fallopian transfer. Okay, these are two techniques, but you need to be cautious, we can get confused. Either what is actually this gamete, it's only going to get, you're not going to transfer the gamete. Here you're going to transfer the zygote. That makes the difference here. So in case of gamete intra-fallopian transfer, you can see the gamete intra-fallopian transfer, sperms and eggs are placed in the fallopian tube. To allow the fertilization in the natural site, the women must have at least one normal open fallopian tube. In that the women and wife fallopian tube healthy இருக்கணும். Fallopian tube problem இருந்துச்சுன்னா இந்த procedure பண்ண முடியாது. We cannot do this procedure either with zygote or the gamete. If the female, the wife, she is having a problem with the fallopian tube or blockages in the fallopian tube, definitely this procedure will not work out. She must go with some other procedure. If the female, she is having a healthy fallopian tube, she can go with any of this technique. Here in gamete intrafallopian transfer, you take an egg and sperm from the human body and introduce directly what? Introduce directly to the fallopian tube, where we could see the fertilization occurs in the fallopian tube. This you should be very careful. So main difference between the GIFT and the ZIFT is in gamete intrafallopian transfer, fertilization in the fertilization is happening in the fallopian tube actually. Okay. So what happens, like, in this case, like, fertilization is happening in the fallopian tube. But zygote intrafallopian transfer, where the fertilization takes place, here the fertilization is not taking place in the fallopian tube. The fertilization is taking place in the laboratory condition in the test tube. Zygote வரைக்கும் fertilization எங்க தான் நடக்குது, உடம்புக்கு வெளியில நடக்கும். That is in vitro condition. அதுதான் in vitro ன்னு சொல்லுவோம். In vivo னா உடம்புக்குள்ள. In vitro means test tube, artificial lab condition வந்து in vitro ன்னு சொல்லுவோம். The main difference என்ன அப்படின்னு கேட்டா, இங்க gamete transfer பண்றோம், இங்க zygote transfer பண்றோம். But இன்னொரு difference என்னன்னா, gamete intrafallopian transfer in the technique where you could see the fertilization takes place inside the fallopian tube. But zygote intrafallopian transfer, you could see the fertilization is taking place in vitro condition. It means outside in the laboratory condition. Fertilization முடிஞ்ச பிறகு தான் the zygote form ஆகும். You know, right? Zygote is a diploid where male sperm or the female egg fuse ஆக வச்சு zygote form ஆன பிறகு தான் zygote நம்ம என்ன பண்ண போறோம், fallopian transfer tube transfer பண்ண போறோம். So mode of fertilizationல இங்க ரெண்டு டிஃபரன்ஸ் இருக்கு. இங்க fallopian tubeக்குள்ள போய் தான் fertilization நடக்கும். இங்க ஆல்ரெடி fertilization வெளியில நடந்துருச்சு. fertilization நடந்து முடிஞ்ச பிறகு zygote-ஆவே உள்ள transfer பண்றோம் fallopian tube. So this makes the difference between difference between the GIFT and the ZIFT actually. So here in ZIFT, what we doing? Here actually in the zygote intrafallopian transfer, we carry out the fertilization in the zygote or the embryo. Embryo வந்து 8 blastomeres வரைக்கும் போகலாம். So the condition is there. Zygote இல்லனா embryo. Embryo na full developed embryo கிடையாது. 8 blastomeres. We can wait until like 8 blastomeres, right? At the 8 blastomeres stage, once it reach, and this can be transferred. This can be transferred to the fallopian tube. So zygote, or sometimes we can transfer the embryo, but only till 8 cell stage. Exactly, you said 8 cell stage or 8 blastomeres form ஆகுற வரைக்கும் மட்டும் ஸ்டாப் பண்ணிட்டு then we can transfer that particular zygote at the 8 cell stage to the fallopian tube. But the fertilization இதுக்கு வெளியில நடக்கும், உடம்புக்கு வெளியில நடக்கும். இங்க gamete intrafallopian transfer fertilization வந்து உள்ள உடம்புக்குள்ள நடக்கும். That makes the difference between zygote intrafallopian transfer and gamete intrafallopian transfer, and this area you should be clear. So இந்த ரெண்டுக்கும் உங்களுக்கு கன்ஃபியூஷன் வரக்கூடாது. Between the gamete intrafallopian transfer க்கும் zygote intrafallopian transfer க்கும் நடுவுல கன்ஃபியூஷன் வரக்கூடாது. சரிங்களா? So blastomereன்றது என்ன நீங்க படிச்சிருப்பீங்க. The trophoblastல அதுக்கு அப்புறம் வருது. First என்ன 2 வந்து 4 ஆகும். 4 வந்து அப்புறம் என்ன ஆகும்? 8 ஆகும். இந்த 8 ஸ்டேஜ் வருதுல, இந்த 8 ஸ்டேஜ் வந்து நம்ம என்ன சொல்றோம்? 8 blastomere ஸ்டேஜ். அதுக்கு அப்புறம் வருது உங்களுக்கு என்ன 16, 32, அப்புறம் தான் உங்களுக்கு என்ன வரும்னா அந்த morula ஸ்டேஜ் இதெல்லாம் வரும். அப்புறம் தான் இந்த trophoblast இதெல்லாம் படிப்பீங்க. But நம்ம என்ன பண்ண போறோம்? We're going to stop in the in vitro condition at the 8 blastomere stage. அந்த 8 cell stage ஓடவே வெளியில ஸ்டாப் பண்ணி அதை எதுல ட்ரான்ஸ்ஃபர் பண்ண போறோம்னா we're going to transfer inside. So this is what is going to take place in this place where it's kind of like CVS technique also. So this technique also can be applied. Okay, so we're done with this part. And coming to the gamete, we already discussed about the gamete intrafallopian transfer. We discussed already. It involves the transfer of both sperm and unfertilized oocyte in the fallopian tube. This allows the fertilization to naturally occur in vivo. Guys, you listen. So this is not in vitro. Gamete intrafallopian transfer is in vivo. In vivo means which occurs inside the body naturally. In vitro means artificially. Okay. So the gamete intrafallopian transfer is in vivo. Zygote intrafallopian transfer is in vitro. Fertilization takes place in vitro, and the difference புரிஞ்சுக்கணும், right? Then 2 oocyte along with 2 to 5 lakhs motile sperms are placed in a plastic tube container. Then oocyte sperm combination is injected 4 cm into the distal end of the fallopian tube. எந்த அளவு வரைக்கும் போகணும் அப்படினா just 4 cm into the distal end of the fallopian tube. That's the location கூட இருக்கு. நீங்க பாடு உள்ள கொண்டு போய் அனுப்பிட கூடாது. So the 4 cm where you could see it into the distal end of the fallopian tube. This is the part where it should stop, right? So this is the procedure where you could see in case of gamete intrafallopian transfer. Gamete intrafallopian transfer. Okay. So we're done with gamete, that is GIFT. Next we move on to IUT. Can you give me an expansion for IUT and ICSI. இந்த ரெண்டுக்கு என்ன expansion கொடுப்பீங்க? IUT, then we have ICSI. So what you do in IUT? Intrauterine transfer. IUT stands for intrauterine transfer. In IUT, what we going to do in IUT? Embryo with more than 8 blastomeres. Number zygote enna padchona 8 cell stage we going to stop it. But IUT, intrauterine transfer, நம்ம என்ன பண்ணுவோம்னா more than 8 blastomeres வரைக்கும் என்ன பண்ணுவோம்னா we going to develop it. Okay, here it will go in IUT, intrauterine transfer, more than 8 blastomeres. It goes more than 8 blastomeres. This can go, and this will be injected to the fallopian tube. So where the embryo, so it's more than 8. Here you could see more than 8 cell stage, and this is getting transferred inside. So this is what actually that you do in intrauterine transfer. When you come to this part, ICSI stands for intracytoplasmic sperm injection. What is ICSI? Intracytoplasmic. Where I tell you what is ICSI. ICSI is embryo, till embryo it's developed in a lab, in the laboratory condition. The embryo is getting developed, in which sperm is directly injected into the ovum. Actually, ovum kulla nam enna pannuvom kettingna, the sperm will be directly injected to the cytoplasm of the ovum. That is the reason we call it as intracytoplasmic sperm injection. Where you could see this place where the controlled ovarian stimulation, then we have the oocyte collection, then we have the stage called as sperm collection, then we have the ICSI. Can you see in this part where we are injecting the sperm into the cytoplasm? We're injecting the cytoplasm where the embryo is getting developed in the in vitro condition, and then this embryo will be transferred into the uterus. So this is called as intracytoplasmic sperm injection. This is the technique where the sperm is directly injected to the cytoplasm of the egg. So this technique is called, but it is in vitro. எது வரைக்கும் in vitro? Embryo form வரைக்கும், form ஆகுற வரைக்கும் in vitro. அதுக்கு அப்புறம் வந்து என்ன பண்ணுவோம்? Embryo வந்து உள்ள transfer பண்ணிடுவோம். So this technique is called as intracytoplasmic sperm injection. Okay, so far what are the things that we discussed? We discussed about artificial insemination, gamete intrafallopian transfer, zygote intrafallopian transfer, intrauterine, that is IUT we discussed, then intracytoplasmic sperm injection, right? This 5 techniques that we discussed. இது இல்லாம இதுலயே problem solve ஆகல, அப்படி infertility வந்து problem solve ஆகலனா, then what else we can do it? We can go with the next thing, we call it as a surrogate mother. What do you mean by the surrogate mother? So surrogate mother. When you come to this part, the surrogate mother, so what do you mean by the surrogate mother? Can someone tell me what is surrogate mother? In surrogate mother, where you could see here, where she could see where the infertile women is infertile, but husband's sperm can be used. Male is not infertile. Male is fertile. Husband's sperm is normal. It's no problem with the husband. But when you could see the women is actually maybe wife might be having a problem. Infertile women, where you could see what happens the husband's sperm will be injected to the womb of the another normal woman. You're getting what I'm trying to say? Here the wife is having a problem. So what I'm going to do is I'm going to collect the sperms from the husband, but the woman is a normal woman. I'm going to hire the woman where I'm going to take the womb of another normal woman. But what is the problem here? The baby will be having the genes of only the father and not of the mother. Can you getting what I'm trying to say? If you go with this procedure, the surrogate mother, because the surrogate mother where the condition, the female is infertile, because I'm taking the womb of the normal another woman, but I'm injecting the sperm of the husband only. So the child will be having the genes of the chromosomes of the father, but not of the mother. So this condition is very common in case of surrogate mother. Okay, the surrogate mother becomes, and she gives the baby in order to give someone who cannot have the children. So surrogate, we are hiring it, we are taking for a rent. So this is what we call it as a surrogate mother. But the condition definitely where the women must be having some problem, but normal male is fertile, but women is infertile. So the child will be having the characters, the genes of the father and not of the mother. If you go with the technique called the surrogate mother. Then what is womb leasing? Can you tell me what is womb leasing? There should be some difference between the surrogate mother and womb leasing, right? What is womb leasing? Can you tell me what is womb leasing? womb leasing, where the women, she have the ability to produce egg. I cannot tell, like, women is infertile, but in surrogate mother, women is infertile. But in case of womb leasing, both are fertile. Women can produce egg, male can produce sperm, but she cannot carry a baby. But she may be having some problem with the uterus. She won't be having a healthy uterus or endometrium. She might be having some problem. There's a problem with only implantation, but she can produce an egg. So this time what we're going to do is, actually, I collect the egg from the wife and I can collect the sperm from the husband. I'm going to make it like fertilized, and then I'm going to hire only the womb. But another women. But in this case, you could see the baby, the child will be having the characters or genes of both the mother and father. Getting what I'm trying to say? That is the difference between the surrogate mother. But in surrogate mother, here the mother is having a problem with producing egg itself. But in case of womb leasing, the mother is having a problem only in carrying a baby, but she can produce the egg. Getting what I'm trying to say? So I collect the egg from the wife, I collect the sperm from the husband, I'm making like in vitro IVF fertilization, but I transfer this embryo or the zygote to the healthy normal women. So I'm going to lease it. I'm just going to take the womb for a leasing. So this technique is called as womb leasing. But in this, the child will be acquiring the characters. அப்பாவோட கேரக்டர்ஸும் இருக்கும், அம்மாவோட கேரக்டர்ஸும் இருக்கும். எப்போ? womb leasing. But when you go with the surrogate mother, where the child will be having the characters only of the father, not of the mother. Okay, so this is what actually you could see in this case, where in case of womb leasing. But you must know the difference between the surrogate mother and the womb leasing. Okay, guys, so you're done with this one. So this is what you should, okay, remember. Then we move on to the next part. Embryo donation. What is actually, we have a lot of donation, blood donation, you would have heard about it. But what is this actually called it as? Embryo donation. Coming to embryo donation. Embryo donation, if wife cannot produce egg, wife can a problem, she can have carry a baby, but the problem is only with what? She cannot produce the egg. Then egg can be taken from the donor. There will be women like, எப்படி ப்ரிசர்வ் பண்ணுவீங்க, there is the cryo preservation techniques வச்சு ப்ரிசர்வ் பண்ணி வச்சிருப்பீங்க இல்லையா, அதுல எழுதி the donor women கிட்ட இருந்து வர எக் என்ன பண்ணுவோம், we collected and fertilized in vitro condition with the sperm of the husband, but the child has the genes from her husband and not from the wife. இதுல என்ன ப்ராப்ளம்னா, குழந்தைக்கு சைல்டுக்கு யாரோட கேரக்டர்ஸ் இருக்கும்னா ஃபாதரோட கேரக்டர்ஸ் இருக்குமே தவிர அம்மாவோட கேரக்டர்ஸ் இருக்காது. why? because someone else has donated. வேற யாரோட எக் தான் நீங்க எடுத்திருக்கீங்க. so definitely, like, the child will be having the characters of only the father and not of the mother, because the embryo has been donated by someone else actually. Getting egg, the egg has been donated by someone else. So this technique is called as embryo donation. Clear with this, guys? Okay, fine. Yeah. Okay, fine. So we're done with the embryo donation. Next we come to the test tube babies. This is actually, we would have studied already about this test tube babies. Simply we call it as IVF. IVF, we call it as test tube baby. In vitro fertilization, we call it as in vitro fertilization. So coming to this part, in vitro fertilization. So what is in vitro fertilization? We talk it as in vitro fertilization. We doing everything in the test tube. There are stages you could see, where you could see the ovarian stimulation hormone therapy. So the first stage in vitro fertilization, where we need to stimulate the hormone. The hormone is stimulate pannu. Ovarian stimulation hormone therapy has to be done, and this under the control of ultrasound control, and then egg will be picked up by means of the aspirator. Egg will be picked up by means of the aspirator. After this, what is going? The sperm will be prepared. The third stage will be sperm preparation, then egg fertilization. Egg fertilization mudinja piragu, then egg and the sperm will fuse together and form the embryo development. Now the embryo has been formed. So the embryo has been formed by means of this cannula. This we call it as a cannula. By means of the cannula, the embryo will be transferred to the mother's, the women's uterus, and this fertilization is called as in vitro. Because why we call it as in vitro fertilization? Here the fertilization is taking place in the test tube. That's the reason why we call it test tube babies. It means the baby is not in the test tube. With the most of the fertilization, the techniques like it's happening in a in vitro condition, in artificial laboratory condition. Adhanala idukku enna type of fertilization solrom ketta, we call it as in vitro fertilization. We call it as test tube baby. Okay, test tube baby. Fine. Okay. So we done with this part. The last one we come to this part is called as amniocentesis. Coming to the amniocentesis, we already discussed amniocentesis has got both positive as well as the negative part. So usually amniocentesis, this technique, when you talk about the positive aspect of the amniocentesis, any chromosomal abnormalities, any deficiencies, chromosomal deformities, any hereditary problems like the women she experience, like definitely we'll do with the amniocentesis. We just find out. We discussed already about the karyotyping technique. Now படிச்சிருக்கோம் ideogram, karyotyping. இந்த chromosomes numbers வந்து ஏதாவது chromosome structureல எந்த chromosomes இருந்து deformities இருக்கு, abnormalities இருக்கு, like example Down syndrome, sickle cell anemia, இந்த மாதிரி problems வந்து we can sort out by means of amniocentesis. But same amniocentesis by means we can even find out the sex, but as per the act, like we should not reveal the sex of the fetus actually. So but amniocentesis மூலியமா what we can do is, see, if you see the amniocentesis, the test, you could see this is an ultrasound. You could see the transducer, we call it as. This is a transducer. Externally, we could see the transducer. This transducer is connected with the ultrasound machine, and the syringe. The syringe has been like injected, and we'll be collecting the fluid. This fluid is called as amniotic fluid. So only the experienced hand can perform this need. This is a very thin needle. Thin needle. Can you tell me how much the quantity of amniotic fluid can be taken? There should be some quantity, right? So they take usually like 10 ml. The 10 ml of the amniotic fluid, usually they collected the 10 ml of amniotic fluid can be collected. But when, can you tell me the time duration when the amniocentesis can be done? எப்ப வேணா பண்ணலாமா amniocentesis? Is there any time duration before that only? And the weeks குள்ள தான் நீங்க அந்த time of pregnancy குள்ள தான் amniocentesis பண்ணணும். எத்தனை weeks குள்ள நீங்க டெஸ்ட் பண்ணலாம், amniocentesis டெஸ்ட் பண்ணணும். So there is a actually time duration even to perform amniocentesis. Usually it has to be performed, the amniocentesis, it has to be performed. It is safe only if you perform, if you do it only before 15th week of pregnancy. 15 வாரத்துக்கு முன்னாடி pregnancy வரைக்கும் தான் நீங்க என்ன பண்ண முடியும்னா, you can do the technique called as amniocentesis. And in the amniocentesis வந்து usually வந்து இந்த spina bifida, genetic disorders, இந்த மாதிரி cases எல்லாம் வச்சு என்ன பண்ணுவீங்கடா, you can do it. So only you take this time. What is the time duration you can take? You can take it actually like 15th week வரைக்கும் தான் பண்ணணும். And when you see actually like this procedure, it takes, what is the time duration? The test முடியறதுக்கு எவ்வளவு time ஆகும்? It takes only 2 to 3 minutes. Only 2 to 3 minutes only this particular test will take. And certain areas like in the test முடிஞ்ச பிறகு என்ன ஆகும்னா certain exercise மாதிரி சொல்லுவாங்க, because there will be some problems like pain or some type of other problems may come. So just a 2 to 3 minutes procedure, they're going to take only the 10 ml of amniotic fluid, and they're going to find out whether is there any problem in the chromosomes or the genetic makeup of the fetus. Okay, amniocentesis. What is amniocentesis? It is a technique used to diagnose the fetal abnormalities by drawing a sample of amniotic fluid by a hypodermic needle. It's not a normal needle. This needle we call it as an hypodermic needle. The hypodermic needle, okay, hypodermic needle பண்ணலாம், இந்தியால பண்ணலாம், but under the approval ஓட பண்ணணும். But amniocentesis வச்சு we should not disclose மேலா ஃபீமேலான்றத மட்டும் தான் ஸ்டார்ட் பேன் பண்ணிருக்காங்க தவிர. But 15 weeks குள்ள நம்ம we can find out whether like is the fetus having any genetic abnormalities இருக்குன்றத பார்க்கலாம். So the needle is inserted through the mother's abdomen. Abdomenல இருந்து uterus குள்ள போய் then we collect the amniotic fluid. But just before that, keep it in mind 15 weeks குள்ள தான் பண்ணணும். When, எப்போ பண்ணணும், எப்போ இந்த டைம்ல இருந்து amniocentesis பண்ணணும்னா, the women who is like 35 years or more, 35 வயசுக்கு மேல இருக்கிற பட்சத்துல தான் mostly இந்த amniocentesis பண்ணுவாங்க. Where you could see in this case, where you could see the women is about like 35 years of age. Okay, 35 years of age actually. So why the ban? So this particular technique, this, I mean, disclosing like sex of the fetus only, it's banned actually, amniocentesis. But karyotyping technique, it's not banned. We can find out genetic disorder 15 weeks kulla பண்ணனும். But women must be having like 35 years க்கு மேல இருக்கிறவங்களுக்கு amniocentesis பண்ணுவாங்க, not less than 35. எதுக்கெல்லாம் பண்ணுவாங்கன்னா chromosomal problems. If the women have the chromosomal problem is identified, okay, so chromosomal problems, chromosomal abnormality, any deformities, I told you the karyotyping in the ideogram மூலமா வந்து we can find out the problems. And couples at risk of prenatally diagnosable genetic condition, already on the couples வந்து வேற ஏதோ problem, genetic problems இருக்குன்ற அந்த சூழ்நிலையில we can even perform this type of techniques where the couples are already having a problem with some genetic problem. அப்படிப்பட்டவங்களுக்கு இது பண்ணலாம், right? So ultrasound indicating like fetal abnormalities. அல்ட்ராசவுண்ட் பண்ற டைம்ல ஃபீட்டல்ஸ்க்கு ஏதோ அப்நார்மலிட்டிஸ் இருக்குன்ற அந்த டைம்ல அல்ட்ராசவுண்ட்ல தெரியும் பொழுது what they can do it, they can even perform amniocentesis, but only under the approval of the registered, I mean like doctors only they can do it. Simply they cannot perform amniocentesis. So authorization is required. So 35 years where you could see like the females may not be like anatomically, she may not be having a matured enough அந்த நேரத்துல amniotic fluid கலெக்ட் பண்ண மாட்டாங்க. 35 இயர்ஸ்க்கு முன்னாடி வரைக்கும் அந்த amniotic sac கலெக்ட் பண்றது to puncture the uterus through the அந்த டெக்னிக்கை பண்ண மாட்டாங்க because it's not safe for the mother. So it's not safe for the mother. So about 35 only they can do it. Okay, fine. So amniocentesis. Next, we last part we come to the part we call it as STD. STD we call it as sexually transmitted diseases. This STD is also called as venereal disease. VD no சொல்லுவாங்க. Venereal disease are sexually transmitted diseases or reproductive tract, RTI no சொல்லலாம். Reproductive tract infections no சொல்லுவாங்க. சரியா? So now we're going to discuss few examples of the sexually transmitted diseases. Where the first one you could see the gonorrhea. Where you could see in gonorrhea. In case of gonorrhea, what is actually the causative agent of gonorrhea? Gonorrhea is a bacterial disease. It's a gram-negative cocci. So gram-negative cocci. It's a Neisseria gonorrhea. நீங்க வந்து gram staining பண்ணி பாத்தீங்கன்னா you could see the gram negative pink color cocci that you could see. Gram negative cocci வந்து ரொம்ப கம்மி. அதுல ஒண்ணு வந்து Neisseria gonorrhea. Neisseria இன்னொன்னு இருக்கு. Neisseria meningitis அது வந்து which cause meningitis which cause. But Neisseria gonorrhea which causes gonorrhea, that is a sexually transmitted disease. It's a sexually transmitted disease actually. So what are the symptoms that you could see in the females? It affects both the male and the female. But in a female, you could see lower abdominal or pelvic pain இருக்கும் female, bleeding between the periods in females, excessive bleeding that the female can experience, and spotting after the intercourse in a female. These are the common symptoms that you could see in case of like the females. Coming to the male, you could see the greenish yellow or white discharge from the private parts, that is enough, even from the periods. You could see the discharge which comes out. So this also shows a sign, a symptom. Maybe he may have got affected with the gonorrhea. And conjunctivitis. This can affect even like inflammation in the conjunctiva, eyes, itchiness that you could see. Swollen glands in the throat due to the oral sex. If they may have been involved in the oral sex, sometimes like they may be having a problem in the throat also. So they should be extra cautious. But it is curable. This gonorrhea is curable only. It's a bacterial disease which caused by Neisseria gonorrhea. Next, we move on to the STD. STD, that is syphilis. What is the causative agent of syphilis? Can someone tell me the causative agent of syphilis? The syphilis causative agents, which comes and again is a bacterial disease, which comes under the class of like spirochetes. I'm already படிச்சிருக்கோம் இல்லையா? So, what is the causative agent of syphilis? Gonorrhea க்கு வந்து Neisseria-ன்ற மாதிரி. What is the causative agent of syphilis? Causative agent. இதுல வந்து we have the stages. We have the primary syphilis, we have a secondary syphilis, we have a tertiary stage syphilis. Sometimes syphilis வந்து headல இருந்து toe-க்கு பரவும், சில நேரத்துல toe-ல இருந்து head-க்கு பரவும். So ascending syphilis னு சொல்வாங்க. Sometimes it may be called it as a descending syphilis. The causative agent is Treponema pallidum. So yeah, it is correct. The causative agent of syphilis is Treponema pallidum. It's a spirochete. In the spirochetes, எப்படி ஐடென்டிஃபை பண்ணுவாங்க? டார்க் ஃபீல்ட் மைக்ரோஸ்கோப்ல யூசுவலி they identify where the background is dark, where the spirochetes Treponema pallidum வந்து பிரைட்டா தெரியும். So this is about. இது எப்படி symptoms தெரியும்னு பாத்தீங்கன்னா symptoms are chancres. இந்த மாதிரி chancres மாதிரி in the pineal region can you see the chancres? In the back side where you could see the rash like the rashes will appear. இது என்ன ப்ராப்ளம்னா இனிஷியல் ஸ்டேஜ்ல வந்து இந்த rashes வந்து ஹீல் ஆயிடும். அகைன் செகண்டரி ஸ்டேஜ்ல வந்து திருப்பி வரும், ஹீல் ஆயிடும். But tertiary stage வந்து maybe sometimes it may not be cured. Initially, if you diagnose the syphilis, what is the diagnostic technique? என்ன diagnostic procedure நீங்க for example typhoid நீங்க எடுத்துக்கிட்டீங்கன்னா viral test பண்ணுவீங்க. HIV ன்னு எடுத்துக்கிட்டீங்கன்னா ELISA டெக்னிக் பண்ணுவீங்க இல்லையா? இதுக்கு என்ன டெஸ்ட் பண்ணுவீங்க? syphilisக்கு என்ன டெஸ்ட் diagnostic test பண்ணி நீங்க கன்ஃபார்ம் பண்ணுங்க. Can you tell me the diagnostic procedure that you can do for the confirmation of syphilis? சிஃபிலிஸ்க்கு நம்ம பண்ற டெஸ்ட் வந்து ரெண்டு டைப் ஆஃப் டெஸ்ட் பண்ணுவோம். ஒன்னு வந்து ஆர்பிஆர். ஆர்பிஆர்னா ரேபிட் பிளாஸ்மா ரியேஜன் அப்படின்னு சொல்லுவோம். ஆர்பிஆர் டெஸ்ட் ஒன்று இருக்கு. இன்னொன்று வந்து டிபிஹெச்ஏ. டிபிஹெச்ஏனா ட்ரிபோனிமா பேலிடம் ஹீமக்ளூட்டினேஷன் ஆசே. டிபிஹெச்ஏ இந்த ரெண்டு டெஸ்ட் வந்து யூசுவலி எதுக்கு பண்ணுவாங்க கேட்டீங்கன்னா சிஃபிலிஸ் பண்ணுவாங்க. ஸோ சிஃபிலிஸ்க்கு வந்து டிபிஹெச்ஏ டெஸ்ட்டும் RPR test இந்த ரெண்டு டைப் ஆஃப் டெஸ்ட் வந்து யூசுவலி பெர்ஃபார்ம் பண்ணி பார்த்தா they can confirm whether the patient is having like syphilis or not. Here you could see the chancres. இந்த மாதிரி chancres மாதிரி வரும். Can you see the chancres under the testicular region, the private parts where you could see like this type of chancres that you could backside இந்த மாதிரி you could see the rashes. These are the stages, three type of stages வந்து என்ன பண்ணிருப்பாங்கன்னா பிரிச்சிருப்பாங்க. சில இடத்துல வந்து latent syphilis வரும். latent syphilis TPHA. TPHA na Trichomoniasis pallidum hemagglutination assay. TPHA. இன்னொன்று வந்து RPR. RPR stands for Rapid Plasma Reagin. REAGIN. Okay, reagin. REAGIN. Rapid Plasma Reagin. இந்த ரெண்டு டெஸ்ட் தான் நம்ம என்ன பண்ணுவோம் இதுக்கு சிஃபிலிஸ்க்கு வந்து பண்ணுவோம். சரிங்களா? So fine. So this about the syphilis. இதுல நீங்க causative agent தெரிஞ்சுக்கணும், syphilis ஓட symptoms தெரிஞ்சுக்கணும். Then இது வந்து viral infection. So genital herpes is also like see, can you see this type of like herpes virals you could see, genital herpes that you could see. Genital herpes the symptoms எப்படி இருக்கும் அப்படின்னு கேட்டீங்கன்னா fever, headache, then you have malaise and meningitis, inflammation of meninges, acute urinary retention. You could see this type of like manifestation, the symptoms you could see like warts kind of thing that you could see, right? Kind of papilloma mary and the mary. This is a viral structure, microscope structure on the skin, on the genital regions that you could see this type of like chancroid that you could see in this case. Fine. So this is case of genital herpes. It's a viral infection. Then chlamydiasis and genital warts. Chlamydia is also like sexually transmitted diseases. It's the most chlamydia on the common bacterial sexually transmitted diseases. Just name மட்டும் ஞாபகம் வச்சிட்டா போதும். இதுல இருந்து mostly questions வராது chlamydia. But name ஞாபகம் வச்சுக்கங்க. Chlamydia is also sexually transmitted disease, but it's a bacterial STD. Then genital warts. Genital warts we could see where you could see the small bumps can feel hard or soft, can take on like cauliflower like appearance. Skin மேல வந்து எப்படி இருக்கும்னா ஒரு cauliflower சின்ன cauliflower இருக்கிற appearance மாதிரி you get it. And most of the people they will not get a symptoms with this one HPV, that is genital warts, maybe shingles and சொல்லுவோம். இந்த மாதிரி symptoms sometimes இருக்காது, but இருந்துச்சுன்னா they can diagnose and it is curable. Chlamydia is curable and this is also curable, but it's a genital wart, that's a viral infection. Okay, fine. So hepatitis, then trichomoniasis. Trichomoniasis where you could see it's actually like protozoan trichomoniasis. It's also a STD, sexual transmitted diseases, where you could see like burning sensation after ejaculation, urge to urinate frequently. These are the common symptoms. Vaginal bleeding in case of female, vaginal bleeding, genital swelling, so pain during sex. These are the common symptoms of trichomoniasis. This can spread from the female to male and male to even the female during unprotected sex, having a multiple sex partners. This sexual transmitted disease are common. Then hepatitis A. We should be very careful. Hepatitis B and A I'm talking about. Here the symptoms are the dark urine, the feeling weak, vomiting sensation, nausea, fever, jaundice, the digestion disorders, and pain in the right side of the abdomen. These are the common symptoms of hepatitis. Okay. So the last we come to conclusion where AIDS. This we already discussed about HIV, that is acquired immunodeficiency syndrome, but this is not curable. All other sexually transmitted diseases are curable. HIV we already discussed in immunology. நம்ம life cycle பத்தி detail நம்ம HIV பத்தி already பார்த்துட்டோம். Symptoms எல்லாமே பார்த்திருக்கோம். So அதனால I'm not going much in detail about, because we discussed already about replication, pathogenicity, clinical manifestations எல்லாமே பார்த்துட்டதுனால we are not discussing much about the AIDS, that is human immunodeficiency virus, which cause acquired immunodeficiency syndrome. Okay, well, we're done. So now by this we completing the first part, this particular chapter. Now we move to the questions. Question 1. Identify from the following sexually transmitted disease which does not specifically affect the sex organ. Which is the correct answer? Sexually transmitted disease தான், but எந்த sex organs affect பண்ணாது. இதுல எது வந்து which will not affect the sex organ. Okay, the sex organ. Okay, right? Which will not affect the sex organ. So option 1 is the correct answer. Option 1 is the correct answer. So AIDS which will not specifically affect the sex organ. So we're done with 1. Next, one of the ART in which a sperm is directly injected into the ovum is called. What is this actually? The technique we call it as the second one. What is the technique we call it as? One of the ART in which a sperm is directly injected into the ovum. Is directly injected into the ovum. Is called as, what is that? This we call it as. It's directly injected into the ovum. Is called. We call it as ICSI. Option 4 is the correct answer. Intracytoplasmic sperm injection. So option 4 is the correct answer for this one. Okay. Next question. The hormone releasing IUD. This type of questions also may come. The hormone releasing IUD. Can you give me an example for the hormone releasing IUD? Which is a hormone releasing IUD? Idhula edu hormone releasing IUD? Hormone releasing IUD. Here. Which is hormone releasing IUD? LNG20, Lipislu, Copper T, Multilode 375. So which one? So here we could see LNG20 is a hormone releasing IUD. Hormone releasing IUD is a LNG20. Okay, so we're done with this question 3. Next question. Induced abortion is also called. Induced abortion. What is the other name for induced abortion? Induced abortion. STD, MTP, IUD, PID. PID na pelvic inflammatory disease. That's the expansion. PID. Pelvic inflammatory disease. Which is other name for induced abortion? This is induced abortion and medical termination of pregnancy. So option 2 is the correct answer. Medical termination of pregnancy is the correct answer. So option 2 is the correct answer. Medical termination of pregnancy. Next, Sageli. Is the correct? Which is the correct one? Where you could see in Sageli, once in a week pill, non-steroidal, no or less side effects, high contraceptive value. Is the correct? Which among the following is correct in for Sageli? Can you tell me, like, which is the correct option for Sageli? Out of 4, which is the correct option is correct for Sageli? In this case, like, all the options are correct. Ellame correct. All 4 are correct. So all 4 are correct. All the 4 points are relevant only. So this questions may not come, since you need to understand, like, just given this type of, all the 4 points are correct in case of Sageli. Okay, well, so all the 4 are correct. All the 4 options are correct. Okay, the appearance of chancre rashes all over the body or the symptoms of. Idhula edoda symptoms. Vadamla chancres varum. Chancres rashes. Rashes all over the body or the symptoms of. All over the symptoms of. Idhula edoda symptoms. Gonorrhea, AIDS, actually. So where you could see the symptoms, the chancres, the rashes, where you could see the symptoms. Here, the chancres rashes you should usually get in case of syphilis. Syphilis la dhaan the mari symptoms varum. So option 3 is the correct answer for this particular question. So option 3. So last few questions. Option 3. Question 7. The common means of transmission of AIDS. Idhula edu the common means edu mooliyama AIDS parum. The common means of transmission of AIDS. Sexual intercourse, maybe unprotected sex. It should be unprotected sex, blood transfusion, placental transfer, droplet and aerosol. Which among this is actually the correct option for the common means of transmission of AIDS? So here the first 3 options are correct actually. The first 3, 1, 2, 3. So usually HIV, AIDS, which won't be transferred by means of droplet and aerosol mulima paraval. But sexual intercourse mulima paravu, blood transfusion mulima paravu, placental transfer mulima paravu. But 1, 2, 3, amma lendu kulandaikum paravu. Third is also correct. So droplet and aerosols mulima, what it will not do is it will not spread actually. So don't have the misconception. It spread through the droplet and aerosol. Okay, well, fine. So next, RCH. Expansion, correct of expansion and RCH expansion. What is the expansion for RCH? Routine checkup of health, reproduction cum hygiene, reversible contraceptive hazard, reproductive and child health care. Which is the correct option? Which is the correct option for expansion for RCH. The correct expansion for RCH is reproductive and child health care. This is the correct option. Reproductive, we already discussed, right? Reproductive and child health care is the correct option for RCH, expansion for RCH. Ninth question, World AIDS Day. என்னைக்கு வேர்ல்ட் எய்ட்ஸ் டே செலிப்ரேட் கமெண்ட்ஸ் பண்றாங்க. வேர்ல்ட் எய்ட்ஸ் டே நவம்பர் 1 டிசம்பர் 1 ஜூலை 29 அதாவது இன்னைக்கா இல்ல டிசம்பர் 21. Tell me the date, right, where the World AIDS Day is commenced. World AIDS Day. When the World AIDS Day is commenced. Number 1, December 1, July 29, December 21. So when the World AIDS Day? World AIDS Day is December 1. So December 1 is the correct answer for this particular question. So question 9, option 2, December 1 is the World AIDS Day. Okay, the last question. Which are the following the reasons for population explosion? Idhula edhu reason actually out of 5 reasons I mentioned, idhula edhula reason, which are the following are the reasons for population explosion? Increased health facilities, rapid increase in maternal mortality rate, rapid increase in infant mortality rate, IMR na infant mortality rate, rapid decrease in maternal mortality rate, decrease in numbers of people reaching the reproductive age. The 5 the options are correct, which is actually following the reasons for population explosion. Population explosion. Which are the reasons here? You could see right now. 1 is exactly 1 and 4. So 1 and 4, these two are the main reasons: increased health facilities and the rapid increase in maternal mortality rate. So option 1 and 4 seems to be correct. Okay. So by this we come to the end of this part. Okay, the reproductive health. So we're done. So option 1 and option 4 is the correct option for the last question. So guys, we're done with this part, the reproductive health. So almost we come to the end of the sessions. We're done. So have enough practice the test papers, everything. If you have any doubts in spite of this, don't hesitate to contact us. We're happy to assist you. By this we complete this chapter. The next session will start with human reproduction. Thank you for joining with us. Take care. May God bless. Hello.